Welcome. Thank you so much for joining us tonight. I'm Jennifer Marshall. I'm the co-founder and executive director of This Is My Brave. We are welcoming everybody in from the waiting room, and we wanted to just take a moment, introduce ourselves. So again, I'm Jennifer Marshall, co-founder, executive director. We are recording, so if you don't feel comfortable and you don't want to be on camera, feel free, you can turn your camera off. We're just going to save the presentation so that we can share it at a later date as well for those who aren't able to make it. But tell us in the chat, and if you can chime in and let us know where you're zooming in from and how you heard about the webinar while we introduce ourselves. So I'll turn it over to Katie real quick.
Hi, my name is Katie Grana. I am a program manager with This Is My Brave, and I am calling in from St. Louis, Missouri.
Erin.
Can you hear me?
Mm-hmm.
Great. I'm Erin Gallagher, and I'm also a program manager at This Is My Brave, and I'm calling in from the Richmond area in Virginia.
Awesome. Andrea.
Hi, my name is Andrea Weaver. I'm a This Is My Brave alumni, but I also work as a licensed clinical mental health counseling associate, and I am in Charlotte, North Carolina.
And Anastasia.
Hi everyone, my name is Anastasia and I am a This Is My Brave intern and I'm calling in from Northern Virginia.
Awesome. So we have John's joining us from St. Louis also. And if you want to join in the chat and let us know where you're zooming in from and how you heard about the webinar, we're going to give just a minute or two until we get started with the presentation. We're so glad you're here. And I see some have family members with them tuning in. This is awesome. I'm admitting everybody in from the waiting room, so bear with us. Let's see. Here we go. So welcome everybody. We're so glad you're here. We're going to get started in just a minute or two here. See, I still have folks coming in from the waiting room. So if you haven't signed up to see one of our virtual shows, we have a lineup of virtual shows starting in October, starting this Sunday, and you can register on our events page, same place where you might have found the webinar. So definitely tune in for those. We're excited to launch those. And so we are going to probably get started. And as we're going through the presentation, as Anastasia goes through everything, please feel free to chime in the chat with any questions. We will save the questions till the end to address those. So feel free to just save your question as we move along, as Anastasia moves along through the presentation, so that we don't miss it at the end. So I am going to turn it over to Anastasia Vlasova. She's our This Is My Brave intern. She has been with us since December, doing a fabulous job leading our teen Instagram account and a number of projects. She's also sharing her story in our upcoming high school edition performance that'll be live streaming on our YouTube channel on October 18th. So, Anastasia, take it away.
I don't have the host setting.
My bad. I need to give you host settings. So sorry about that.
No worries.
Okay, you should have it now.
Okay. Okay, can everyone see this? Okay, great. All right, so thank you so much for coming out today. I'm so excited to talk to all of you about youth and mental health and how parents can get involved with helping their children through mental health struggles.
Anastasia, we can't see your slides, sorry.
Oh. I'm on the slides right now.
Are you doing screen share? Can you do screen share?
That's what I'm not doing. There we go.
There you go.
Sorry about that. Okay.
Do you have at the bottom the green box? There we go.
You should be able to see it now.
Awesome. Now we're good to go. You can start over.
Okay. Okay, so thank you to everyone who's here today. I'm so excited to talk to all of you about youth and mental health and how you can get involved with mental health advocacy and how parents can help their teens through mental health struggles. So today's topics of discussions will be a little bit of my personal mental health story, my involvement with This Is My Brave and This Is My Brave Teens, mental health and its importance, mental health in schools, and then we'll move into how parents can get involved with their teens' mental health, and then I'll finish off with mental health advocacy. So first of all, hello, my name is Anastasia Vlasova. I'm 17 years old. I'm a This Is My Brave intern, so I create content for the This Is My Brave Teens Instagram account where I showcase other young people's mental health stories. I share a bunch of mental health resources, and I share a little bit of my own mental health story. I'm also the host of the Brave Wave podcast, which is an awesome podcast by This Is My Brave that is going to be released really soon, so stay tuned. And I'm the host of the Epic Theory podcast, which is a podcast that I started with two of my friends from school last year in June, I believe. And we have around 25 episodes, I think, available on Spotify, iHeartRadio, and Apple Podcasts, so you can check it out if you want. And then I am the president of Our Minds Matter, which is a mental health club that I will explain in the next slide at our school. And as always, you can find me on This Is My Brave Teens on Instagram. So first, a little bit about me and my mental health story. So my mental health struggles began in around 7th grade. I started experiencing a lot of perfectionistic traits. I started developing anxiety and depression, which manifested in a lot of insomnia and restless sleeping. I always woke up feeling exhausted the next day because I had really intense, stressful dreams, and sometimes I couldn't even fall asleep. And then my anxiety was primarily in the form of social anxiety. So I always got butterflies in my stomach whenever I wanted to speak to someone or in front of a large crowd, which is kind of ironic because that's what I'm doing right now, even though it's online. And then I would get all sweaty and clammy, and it was just not a great experience at all. And then in 8th grade, I developed disordered eating, specifically restrictive and binge eating, because of my involvement with tennis and fitness. And I just developed a really unhealthy relationship with exercise and eating healthy. Luckily, though, I started doing therapy this past February, so I am now in the recovery process of my mental health and my eating disorder, and I highly recommend therapy for everyone. I'm really grateful for the opportunity to have therapy, because without it, I probably wouldn't be presenting all of this information to all of you here today. So the reason that I even wanted to share all of that background information with you all is to start the conversation. As you can see here, it says the stigma surrounding mental health is a result of the lack of open discussion about mental illness, and that could not be more true. The reason people are so afraid of talking about mental illness is because they fear judgment from other people, or they fear that their emotions are going to be dismissed as insignificant, therefore silencing them even further. So the two organizations that I mentioned that I'm involved with are This Is My Brave, which obviously you're here with today. And in case you don't know what This Is My Brave does, it's a mental health awareness nonprofit that works to reduce stigma through storytelling. It's a really awesome organization that combines the performance arts with mental health, and I'm so grateful to be a part of it. And the second organization that I participate in is Our Minds Matter. And Our Minds Matter is a student-led movement designed to change the school culture around mental health. And Our Minds Matter was actually the very first mental health club at my school in my school's history, which is actually very surprising because adolescents have been struggling with mental health for decades and decades, probably centuries. But last year was the first time that we ever started a mental health club at my school. And I really think that it was the best decision for our school because it provides a very supportive, open-minded, welcoming environment for students to learn about emotional intelligence, self-care, and they just feel free to express their emotions and their mental health struggles that they've been enduring. So if you do not have an Our Minds Matter club at your school just yet, I highly recommend starting one. Okay, so now let's get into the core of this presentation, mental health. We throw around the words mental health all the time. We say that we need to nurture it, that we need to take care of it, we have to do this for our mental health and that, but what actually is it? So the definition of mental health is that it includes our emotional, psychological, and social well-being. It affects how we think and how we feel and how we act, and it determines how we handle stress, how we interact with others, and how we make decisions. So obviously this is a very broad definition, meaning that mental health affects basically every single area in our lives. So that means if your mental health is suffering, oftentimes other areas of your life are suffering too, which is why it's so important to educate yourself about what mental health actually is, what you can do to develop proper coping mechanisms, and how to maintain good mental health throughout your life. So now let's talk about the causes of mental illness. What are some of the factors that can cause mental illness in an individual? Well, for one, early adverse life experiences, basically childhood trauma. It's something that every single individual on this earth experiences. And the thing is that childhood trauma doesn't have to be as extreme as abuse or a death in the family. It can be as little as a child who was 5 years old in preschool being sent to time out. And the reason being that children who are that young are so impressionable, they're so new to this world that everything that they're experiencing is basically for the first time. And when it's an experience that's accompanied by guilt and shame or embarrassment, such as being sent to time out, it oftentimes affects their behavior for the rest of their lives, along with their thinking patterns. That's why it's so important to seek help for your mental health so you can identify those childhood traumas and see how they have impacted your behavior today. So some other things that can cause mental illness are experiences related to other ongoing medical conditions, biological factors and chemical imbalances, the use of alcohol or recreational drugs, stress, and personal factors such as perfectionism, which I can definitely speak to because I think that perfectionism was definitely one of the causes of my depression and anxiety. See, I always felt that I had to be perfect in every aspect of my life in order to be considered good enough for society, which luckily through therapy I learned simply isn't the truth. We're all good enough as we are. And another factor that can cause mental illness is loneliness and isolation, which is incredibly present during this COVID-19 time because everyone is socially distanced, which is why it's so important to check in with your loved ones and friends and family and everyone, check up on their mental health and just talk about how you've been feeling. Because when you're socially distanced, it's very hard to maintain social connectedness, which is something that humans just need. So moving on, let's present some mental health statistics among young people. So first of all, suicide is the second leading cause of death among young people ages 10 to 34 years old. And 50% of all lifetime mental illness begins by age 14, and 75% of it begins by age 24. And 1 in 6 US youth ages 6 to 17 experience a mental health disorder each year. So 1 in 5 people live with mental illness, meaning that you probably know at least one person with mental illness. In fact, you might be that person with mental illness right now. And the thing is that this ratio is probably even higher because mental health data is widely underreported. And the reason being that there's such a huge stigma surrounding the discussion of mental health. Again, because people are so afraid of judgment. It hasn't been accepted yet. The conversation of mental health, specifically mental health struggles, isn't commonplace, which is why it's so important to tell your story and be completely transparent about the things that you've been through regarding your mental health. So some more statistics specifically for this COVID-19 time. So 79% of surveyed teens wish there was an inclusive school environment to talk about mental health. Now, again, I can speak to that. You know, I've gone to a school where for the majority of the time, I haven't had a safe place to go to. I didn't have peers who I could discuss my mental health with. And I didn't even have professionals or teachers or anyone who I could talk about mental health with. And 71% of surveyed teens say that schoolwork actually makes them feel really anxious or depressed. And as a senior in high school in the first quarter, in the middle of a pandemic, doing online school, applying to colleges, and submitting dozens of essays basically every 2 months, anxiety is definitely a thing in school. So it's really important that we find a solution, that we create an open environment and a supportive environment for teens to talk about mental health and provide access to mental health resources for adolescents. So furthermore, mental health in schools. So many school districts share one psychologist per approximately 700 students. And for my school, the case is that there's only one psychologist per approximately 2,000 students. And there have actually been instances last year when I went to my counselor first because I was really struggling with anxiety and stress during the school day, and she was occupied with a meeting. So she sent me to the psychologist, who actually wasn't even at school because our psychologist only works every other day. So she's not even there 5 days a week. So I was left without an adult to talk to, and I couldn't concentrate on any of my schoolwork during the entire day. And that makes it a really stressful experience for students when they don't have anyone to turn to. Hence the 60% of students struggling that do not receive help they need due to stigma and a lack of resources. We simply need more counselors and more psychologists equipped with the skills to help students with their mental health at our schools so that we can feel supported and that we can learn in our school environment. And lastly, most teachers are not even trained about mental health in their formal education and degree programs, which I found very shocking because teachers are some of the people that have the strongest relationship with the students. So if a student chooses to confide in their teacher with a mental health struggle or maybe a family issue or some other form of stress with their teacher, and their teacher isn't equipped with the skills to help the student with their mental health, oftentimes the student is left very hopeless and it closes off even further and suppresses their emotions because they think that there's no one in their life that can help them through their situation. So next, I wanted to include a slide about the LGBTQ plus community and their mental health, because I think that the LGBTQ plus community is already so underrepresented and their devastating mental health facts simply need to be shared. So first, transgender youth are 4 times more likely to experience depression than their non-transgender peers. And LGBTQ people are 4 times more likely to attempt suicide than their non-LGBTQ peers. And there are 60% of LGBTQ youth that have said that they feel so sad or hopeless that they stop doing some of their usual activities. So what does all of this data mean? It means that society is losing young people because of an inability to access resources due to a lack of awareness and the presence of stigma. Society is losing thousands and thousands of adolescent lives, people who haven't even gone to college yet, some of who haven't even developed meaningful relationships in their lives yet, or who have traveled or done any of the things that make life great. They're losing their lives simply because they have a lack of accessibility to mental health resources, and this needs to be changed. So I know that there are a lot of parents probably listening to this right now, and I know that the information I've just presented is probably very worrisome, and you're probably wondering, how can you get involved and help your teen? Well, first, you need to identify if it's time to talk. And it usually is if there's something off about your child, but you're not exactly sure what. Maybe your child is starting to have difficulties at home or with their schoolwork or with their friendships. Or maybe you've noticed some of the symptoms on the right of the slide. For example, feeling sad or hopeless or empty, maybe problems with concentrating on schoolwork or other activities. Or maybe they're saying that they feel like their mind is playing tricks on them. For example, maybe they're seeing something that's not actually there, or maybe they're hearing things that aren't even being said. So you've identified some symptoms in your child and you think that they might be struggling with their mental health. Now what do? Well, you have to find a good time to talk. You see, a child's mood will affect their willingness to engage in conversation. So you need to find a time where there's no pressure or agenda and your child isn't distracted by other responsibilities so that they can feel like they have a lot of time to explain their emotions and feelings in an open-minded and welcoming environment. So you've gotten to the point where you can actually start a conversation. How do you do it? Well, there are several options. For one, you can mention some observations of their behavior in a very non-judgmental way. Perhaps you've noticed that their behavior has changed. Tell them that. Tell them what you've noticed. Another thing you can do is provide information. Maybe you've researched your child's mental health symptoms and you've identified that they might be struggling with a certain mental illness. Present your child with this research, or maybe even encourage your child to do some research with you. Because remember, getting through a mental illness is a team effort. You need to have a community around you that is supportive and that is willing to help you and maintain hope. Another thing you can do is mention personal experience. If you've struggled with mental illness, you might as well tell your child that, because the last thing a person with a mental illness wants to hear is that they are totally isolated in their situation. They want to be able to relate to someone. They want someone to hear their problem, or maybe even say, you know what, I've been in that position and I've gotten through it, because that way they maintain hope. And the best thing to have when you're going through a mental illness is hope, because you want to know that there's light at the end of the tunnel. And another thing you can do is maybe present to them some screening results, which is really similar to the information bullet. So for example, if you took a screening survey on MHA, which is Mental Health America Screening.org, and it indicated that your child might be struggling with mental health, show your child the results. Maybe even take the survey together again. Maybe your child disagrees. Just do more research together, because as I said before, it's a team effort. So I mentioned in the previous slides what to do if your teen or child comes to you first. Other way around, if you come to your teen or child first. But what if a child or teen talks to you first? Well, first you should listen. And by listen, I mean actively pay attention to them by stopping the voices in your head as they speak. And by the voices in your head, I mean those biases, assumptions, or opinions that might change the way that you respond to your child. Maybe you were brought up in a way that it wasn't acceptable to talk about mental health. Don't let that affect how you respond to your child, because in that situation, your child wants to feel supported and welcomed. If you dismiss their feelings, that will invalidate them, making them close off even further. Next, offer support to listen and talk it out with them. Again, maybe bounce ideas back and forth on how you guys can get help. Next, what you can do is to normalize and acknowledge the situation. Assure your child that mental health troubles are common and the future is hopeful. This would be a great time to include that maybe you've struggled with mental health, but it's okay, because there's help out there, there are resources out there, and there's a team of people who are willing and want to help you. And then recognize your own fears, but don't let them dictate your behavior, because oftentimes parents get so scared that their child is struggling from mental health issues that they kind of close off, or their behavior changes. And instead, their child misinterprets their fear as maybe an unwillingness to listen to them. And that way they close off even further and never come to you again about their feelings. And the last thing you should do is offer support, offer therapy or counseling, or maybe reach out to their counselor and let them know about the situation. That's actually what my mom did last year, I believe, and actually maybe several years during high school, when I was really struggling with my anxiety and depression, and I was just having a lot of trouble keeping up with all of my schoolwork and balancing my mental health and just family issues and sports and clubs and everything. So if your counselor is aware that your child is going through a mental health struggle, maybe then they'll be able to provide a welcoming and supportive environment in the school where your child can go to during class if they're not feeling their best. And lastly, find mental health help. There are plenty of therapists and psychiatrists and psychologists and other resources that you can connect your child to get the help that they need for their mental health struggles. So I've just presented a lot of information, and you might be wondering, so what do we do now? Well, we speak up. So This Is My Brave's motto is that storytelling saves lives, and this couldn't be more true, because when one person is willing to step forward and be 100% transparent about their mental health background, it inspires other people to do the same. That way, causing more conversation around mental health, specifically unpleasant mental health feelings and emotions and mental illness, to happen, making it more commonplace to talk about it, therefore reducing the stigma and hopefully eventually eliminating the stigma surrounding mental health. Okay, so what can we do regarding mental health advocacy? Well, we can turn to social media, because after all, social media is the powerhouse of information, so we might as well use it for good. You can follow mental health accounts on Instagram. You can repost mental health resources that they post to share information and educate your peers. You can also reach out to mental health organizations about being an ambassador. You see, all of these mental health organizations have a common goal in mind. They want to raise awareness, and they want to reduce the stigma, and they want to get people involved. So if you express interest in being an ambassador, maybe promoting their cause or working with them, volunteering, then they'll most likely take you on. And if not, the worst thing they can say is no, and you can always try another mental health organization, or maybe even start your own movement. Furthermore, if you're into the political aspect of mental health advocacy, you can always ask your governor or mayor to make a proclamation recognizing National Mental Health Awareness events. I'm not super into the political aspect of mental health advocacy. However, there are plenty of websites and resources that you can look up on Google, or maybe ask your friends and family, and then you can get involved with the political side of it, which would be really great because we do need some more laws regarding mental health in our system. Another thing that you can do is you can start a mental health club at your school. For example, Our Minds Matter. I highly suggest it if you don't have an Our Minds Matter club at your school yet. And if you are interested in starting it, you can always check it out at ourmindsmatter.org, and it has a lot of information regarding how to start a club and how to maintain one. And if you have the financial means to do so, you can always donate to organizations such as Mental Health America, which prevents mental illnesses through advocacy, research, education, and services. And lastly, probably the most important thing that you can do and effective thing that you can do is to talk openly about mental health with your friends and family. Because like I said before, storytelling does save lives. And those conversations may be very difficult to have, but again, the most difficult conversations are usually the ones that are most worth having. So here I've listed some mental health resources. This is not at all an exhaustive list. There are hundreds and hundreds of other organizations and books and Instagram accounts and other social media accounts that you can check out. But these are some of my favorites, some of the ones that have impacted my life the most, and some of the ones that I look up to basically every day whenever I do mental health advocacy. And with that, I want to end off this presentation and say thank you so much again for taking your time listening to me ramble on and on about mental health. And if you have any questions, you can always find me at This Is My Brave Teens on Instagram, or email me at anastasia@thisismybrave.org. Or if you're interested in self-development taught by 3 teens, which is questionable, but I highly recommend it, you can always check out The Epic Theory on Spotify, Apple Podcasts, and iHeartRadio. So yeah, thank you so much.
Awesome, Anastasia. Thank you so much. Do you want to stop the screen share, go back to gallery? Can you do that for us?
Oh, there we go. I stopped it. Okay.
So that's our presentation. We wanted to open it up to questions. If anyone has any questions they wanted to jump in with, feel free. We also will be sharing a recording of the presentation in case you missed a slide and you wanted to go back and review like the book recommendations or the Instagram accounts to check out. You can flip through and you'll be able to see it's going to be saved as a video on our YouTube channel. So you'll be able to go back and rewatch and share with your networks as well. And like I said, we would love for you to check out our fall shows that are virtual, streaming on our YouTube channel beginning this Sunday. Is our Houston show. The show that Anastasia is going to be presenting her story in will be October 18th, featuring all young people that are in the DC area. So check that out. So I'm just looking to see if anyone had any questions they wanted to be brave and share a question, but otherwise, oh, here we go. We have a question. Deanna, 13-year-old son on the autism spectrum. And I think she probably will come up with another part of her question. Let's give her a second here. We're going to give Deanna a second to type in. Faith was asking, what if your parents don't ever really talk about mental health? That's a great question. Does Anastasia want to take that, or go ahead?
So I know from my personal experience, so I'm from Russia, and if you know anything about Russia, the stereotype is that we're cold, we don't talk about emotions, and that honestly could not be more true. And so earlier in my life, my mom definitely raised me as to kind of dismiss emotions and feelings, and like depression and anxiety wasn't really a thing in our culture. So I struggled a lot with that, especially in middle school. And so I started turning to my counselor, who actually reached out to my mom for me. And so I think that oftentimes that can really, really help if you reach out to another trusted adult that's outside of your family, because sometimes when your parent is contacted by for example, a counselor, they kind of realize that, oh, maybe this is a really important situation that really is impacting my child. And that way they kind of get a different perspective on it and maybe become more accepting about talking about different emotions. Because sometimes when you kind of keep it in within the family, it doesn't get through to them, you know? So I think reaching out to someone else, maybe at your school, or if you know a family friend or something, that could probably help. But yeah, I don't know if anyone else has anything to add.
Yeah, no, I think that's a great option. Obviously, going through some other trusted adult, especially some kind of mental health adult. Ultimately, it's great to talk to your parents, and maybe you can start the conversation, right? So maybe you come to them and say, "Hey, this is really important to me," because unfortunately, especially in generations before now, it hasn't been incredibly normal for anyone to talk about mental health, and so it may take this younger generation who's more comfortable with mental health, who hear about mental health, to kind of start those conversations. So it can be something that you bring up to your parents to say, hey, this is important to me, and I'd like for us to talk some more about this.
Katie, would you mind reading the other question? I'm having a trouble with my contact lens.
So Deanna, we'll go back to her question. So she has a 13-year-old son on the autism spectrum. She wants to know, what do you recommend to start a conversation when he shuts down and does not want to talk? She wants to talk and he does not. Any suggestions? Great question. Anastasia, do you want to start there, or
maybe Andrea? Do you want to take that?
Sure, absolutely. So with teens, a lot of times timing is really everything, but especially if your son is on the autism spectrum, that unfortunately creates a lot of trouble with some social connections. So that's going to create some problems too. I think, if they're really not in the mood to talk, then unfortunately you're correct. Like, they will continue to shut the conversation down. And so maybe it's saying, hey, I'd like to have this conversation. Let me know of a couple times that might work for you. Or, if he's starting to shut the conversation down, then, hey, this is a really important conversation that we need to have. Can you come back to me when you feel a little better, right? And so it really can be about timing. And then ultimately, if you want these conversations and your teen is unwilling to have them with you, then that's when I would say seek a counselor. I tell parents all the time, don't get offended if a child is willing to talk to a counselor, even if they don't like having the conversations with you, because at least they're talking to someone. And sometimes it's just good to have someone. I don't have any. If your child came to see me, I don't have any biases against your child. We don't have any power struggles at home. I don't discipline them. So again, open up times to allow the child to decide when they are comfortable talking. Maybe they're really distracted because they really want to play their favorite video game right now. There's so much that's going on in their heads. So I would say, yeah, really open that conversation up to, hey, this is a really important conversation. Let me know when you're ready to have this conversation.
I think also, in addition to that, what I've noticed, at least with my parents and my friends' parents, is changing your approach to asking your child about mental health or initiating the conversation can really help. Because I think that if you try to initiate the conversation multiple times the same exact way and you're not yielding any positive results, then most likely you might want to change your approach. For example, if you're constantly asking them to talk about mental health inside of your house, maybe in your kitchen all the time or in their room, try going on a walk. I actually have a friend who told me her daughter is a psychiatrist, I believe, and she has her own practice, and she goes on walks with her patients, not her parents, with her patients, because she noticed that that usually has the best results because they don't have to make direct eye contact and they're both able to talk. Not both of them. The psychiatrist doesn't talk about her emotions, but her patient does. And she just finds that the patients have an easier time talking about their emotions, but they don't have to make direct eye contact because it's not as an intimidating experience, if that makes sense. So yeah, try different things. Maybe try to do art with them, maybe draw pictures and gradually kind of ease into the conversation about emotions, or maybe go on a walk or play some sort of game or sport and kind of make it less intense than it actually is, because I think that definitely makes it easier for teens to talk about mental health.
I would absolutely agree with that as well. I think sometimes we think that when they're playing video games or doing other things that it's a distraction, but sometimes those distractions can provide a more willingness to be open, because I'm not sitting here being stared down, expected to talk about something that's really uncomfortable to me. So if you allow your child to do something else while engaging with them, it may seem like they're distracted, but that distraction could bring a willingness to be more open.
I did quickly want to add to that as something I learned from a friend when her son was in an emergency situation. She said, turn around. You don't have to look at me, but tell me what happened. And so it can often be, even in emergency situations, a great option, because exactly what we were just saying, there's you feel a little less vulnerable when you're not making eye contact. It's easier to speak. So that can be said for initiating conversations, or if a hard conversation has to be had in the moment. So I just wanted to add that. Let's see. So Faith also said that she's 18 and her mom thinks, and I think my mom, I think, is just finding out how hard it is. I do a mental health TikTok and YouTube, and I think that's helped me a lot lately and for other people. And the Schneiders also offered up maybe considering alternative forms of therapy, perhaps equine therapy or other animals if he's comfortable around animals. So I think all of those proof points of finding outlets that speak to your child, just as we as adults are. We're not always willing to talk about our problems, sitting at work, but maybe over a cup of coffee or on a walk or something like that.
Also, what Faith said about the YouTube and TikTok, I found that that's actually really helpful for a lot of people, especially Generation Z, especially during a pandemic when we can't really talk or interact with a lot of people in person. We were watching a video today in school. It was about like balancing your time on social media and everything. And it was saying, obviously there are pros and cons to social media. Like a lot of people are spending hours and hours a day on it. And there are a lot of negative effects. However, they have found that teens find a greater sense of community on social media, especially when they follow positive accounts such as This Is My Brave Teens, if you want to follow it, or other maybe like mental health accounts and just other upbeat, uplifting, empowering people. Because it makes them feel connected, and usually in a setting where you wouldn't have social media, if you knew of someone like very influential and really awesome and positive and inspiring, you probably would have no direct way of messaging them or talking to them or even like observing their life day to day. But social media makes that really accessible. So I think that's something that teens love. And I think that a lot of parents do yell at their teens for being on social media a lot or maybe on their phones, but I think that there are definitely some beneficial aspects. You definitely do need to find a work-life phone balance, but it's doable. And I don't think that cutting out social media entirely from your life is the solution. I think it's just about finding the right community in social media to participate in. So yeah.
Good point, Anastasia. And one of the accounts that she mentioned in her ones to check out is called Half the Story. It's all about balancing technology and social media. It's a really great account to follow. She has great suggestions and tips for parents and for teens. And then let's see, we had a anonymous question. What about programs like Youth Mental Health First Aid and Sources of Strength? Have these shown to have a positive impact on students with respect to parent-teacher involvement? I don't know a ton about either program, but we do know that they are available and they are beneficial to any kind of mental health awareness, and education can be definitely positive on youth. Youth Mental Health First Aid is more for the administrators, more for the teachers, and a lot of schools are taking that on as an initiative. And Sources of Strength, I believe, is a club model as well. Erin, do you know much about Sources of Strength?
I keep meaning to read more about it because it's come up a few times, but I do know that it's highly has a very good reputation, and we've talked to administrators who've selected to have that club in their school. They like the model of youth leadership. So I think it has, it's accessible. They have this nice charts. They have this basketball that has emotions and stuff on it. That seems to be like the little model that I see often on their promotional stuff. They were recently covered on the Today Show at one school in particular in Pennsylvania that ran their program. So I think it's a strong program.
We had another question from Deanna. What is recommended to have teenagers, in particular young men, to understand it is not a sign of weakness to express their emotions? It's a great question. Andrea?
Yeah, sure. So, I mean, unfortunately, society has really bred this into our young men. So I think it's something that you're going to have to continually talk to your child about to make it seem normal. Because otherwise, the only messages they're getting are from peers. And I think, sometimes parents, they worry about, well, if I bring these things up with my kid, well, then I'm gonna make them have those problems, or I'm gonna make them, feel bad about themselves or recognize their bad emotions. But the thing is these things are happening already. And if we don't address them now, then they're going to keep coming up, and they're going to get messages from wherever they can get them, which is going to come from their peers or from social media or from wherever they can get it. And so really the biggest way to kind of stomp that stigma out is just to continue to have conversations, to make your house a place where emotions can be freely spoken about without judgment. So yeah, it's a lot about starting conversations, and you have to reteach your child, because again, society has unfortunately bred into our young men that this is weakness, and so we have to teach them differently.
I think that's something else that you can do too. I personally struggled with the same thing, even though I identify as a girl. But for the longest time, I also thought that showing my feelings was a sign of weakness, because I always thought that to put on this front of like independence and like leadership and all of that, I couldn't show any emotion because I thought it would be weakness. And because it's such a touchy subject, I think it's really important that you pay attention to the terminology that you use. Specifically, like maybe mentioning the word feelings or emotional or just emotions in general could kind of trigger that response in boys that, no, I don't want to talk about this, and it closes them off. Whereas if you maybe talk specifically about anxiety or depression, or like identify the mental illness instead of saying, let's talk about your feelings or your mental health and all of that, maybe that'll kind of change their response and make them more willing to talk about their feelings without them actually being aware that they're talking about their feelings. So it's a very tricky game, because it is a touchy subject, especially if you didn't raise them to be very open about their emotions. But yeah, just kind of try different approaches, because if you keep doing the same thing over and over and it's not yielding the results that you want, then most likely it's something that you need to change, because they're not the ones initiating it, you are. And I know that's a lot of responsibility, but I don't know, you have to start somewhere. So yeah, I would recommend that.
Yeah, I really like what Anastasia said about bringing up feelings. And so that's definitely a technique, because unfortunately our kids don't have a lot of feeling vocabulary these days. And so they don't know the words to put to what they're feeling. So if you can start talking to them, and maybe they don't know what they're feeling, but you say, okay, well, is it this? Is it this? So kind of explain a couple of different feelings that maybe seem accurate to them. And that way you can prompt them to start speaking, because sometimes kids just don't have the words to put into what they're actually feeling. They don't know the word depressed. They don't know the word, exhausted necessarily to put to what they're feeling. And so, yeah, it's really good for you to have that vocabulary and to use those words around your children frequently, because the more that they hear those words, the more that they become comfortable with them and understand them and are more willing to use them.
We had another question from Casilia, I hope I'm pronouncing that right. I'm 17, a parent, is mentioning it's childish to cry over school, hard to talk about it openly with others. Suggestions, what suggestions might we have?
So the question was, could you repeat the question? Yeah.
If the parent is telling you, you don't need to cry about that, like, how can you initiate that conversation?
Yeah, they're saying that dad says it's childish to cry over school, and that makes it hard to talk openly about it to others, as well as parents.
So I don't know why there's so much confusion coming from me about this question, but so if the child wants to talk to someone and they're having difficulty, what should they do? Okay.
Yeah, so I think part of what the question would be is, you know, sometimes it's easy, and we've kind of talked about this already, that it's easy for older generations, even like into this is my brave, our parents and down, to not want to talk about mental health. And it's easy to say, you know, put on your big boy pants, and where it makes it harder to feel like your concerns are legitimate. So even if you're upset about school and it's really stressing you out, obviously that makes you feel really invalidated when your dad says that it's childish for you to get upset about it. So I think ways to, you know, a lot of things are situational when it comes to mental health, and this goes for conversations as well when you're going to have them. If you're always asking for support, if you're in breakdown mode, it's harder to communicate what you actually need. So maybe have the conversations when, and that's what we try to preach too, is you don't need to wait to go to therapy until you're broken. Go to therapy beforehand and start preventing things that might come up. So if you are expecting to have a tough test coming up that you know is going to stress you out, you know, try to get ahead of it. But again, if you're not getting that support from your parents, talk to a teacher or a counselor or a friend's parent, maybe that you feel comfortable with. It doesn't make our parents bad people. They just see things differently than us.
Yeah, something that I would like, oh, sorry, go ahead.
No, I was hoping you would add on.
Yeah, so to add on to that, well, first of all, I think that it's already amazing that you took the step of recognizing that the reason you are afraid of telling other people about maybe being upset over a test or being really anxious and stuff is because of your parents. Like, that's already a very mature thing to be able to recognize. And at least what I do, because again, like the way my parents were parented is very different from the way that I'm growing up. And our perspectives do clash occasionally. I think it's important to remember that just because your parents raised you this way doesn't mean you have to interact with others the same way. So the things that you avoid telling your parents doesn't mean that you should avoid telling everyone, because your parents aren't like everyone. There are peers out there, and there are even adults too who might be your parents' age that think differently. And so that's why I think it's important, again, to emphasize what Katie said, to reach out to trusted adults, especially counselors in schools. I know that it might seem kind of like, because not everyone has a good relationship with their counselor, or they might have never even spoken to their counselor, but they're there for a reason, and they're there to support the students. And I guarantee you that no matter what counselor you go to at your school, they will be there to listen, and they will not invalidate your emotions, because they're there to support you. So, yeah.
Absolutely. Yeah, I agree with everything that everyone said so far. They're great resources. That's why school counselors are there. And, you know, at that point, if you still don't feel comfortable talking to your parents, then your school counselor might be able to get your parents connected with resources like counselors in the community that you could talk to. So definitely just reach out to anyone that you feel comfortable with, because anywhere that you can get that support, that's totally worth it.
Yeah. Great questions. We appreciate you all so much for being here and for tuning in and engaging with us. And we hope it was helpful tonight. Please stay connected to This Is My Brave. We hope to do more webinars like this in the future. We hope you'll check out the fall virtual shows and follow us on social media. And again, stay connected. So hope everybody has a great evening. And again, thanks for joining us.
Thanks.
Bye.
Bye.
Thanks.